with a special session on World Population Day. On 11th July, every year we celebrate, we observe the World Population Day. Nanda sir, I ask you now, much talked about the National Population Policy. What are the unique features of it, and how does it aim to reduce the population growth rate in our country?
Well, National Population Policy was formulated way back in 2000,
Right.
as you know. And it was after long debates and discourse that this, for the first time in India, we had a comprehensive population policy. Earlier you had the family planning programs, you had some sort of a population policy during emergency, you had one or two, but those are very narrow policies, narrowly looking at population control or family planning. But here was a policy which reflected the needs of women and men, particularly from the gender equity and equality angle, and it was people centered. It was not population control centered. It was people centered. So the needs of the community, needs of the people, needs of men, needs of women, the real felt needs for health, for education, for livelihood, and all integrated manner was presented. This was the policy where the primary premise which started was that the people are our biggest resource. They are the biggest asset, and they have the potential, and they could be really made into real assets of the society. And that, keeping in view that, a holistic policy was framed where you had about 14 socio-demographic goals. It is just not demographic goals, socio-demographic goals. You have something which will be done immediate, something which will be done in the medium term, something which will be done in the long term goals. And you had also strategies. There were 12 strategies which will be taken up with intersectoral convergence. Education was given much more priority, particularly for women and girl children, than even contraceptive. And similarly the state population commissions and in the states. But unfortunately the population commission has sat 3 times during last, the last it sat was in 2010. Thereafter, I don't think we had a population commission session at all. Now the question is, unless you really monitor this holistic intersectoral convergence policy, its implementation in that sort of spirit, it is not going to really, we can know really whether that has happened. But the fact is, there has been lots of improvement over the years, last 17 years or 18 years, 19 years. So these are the problems, the unique features of the National Population Policy.
So there is a talk about reproductive health and
Yes.
reproductive rights.
Mm-hmm.
Both these terms are used often interchangeably. What do you think, how they should be positioned in the context of family planning?
You see, family planning, to be effective, even as family planning, it was based on experience of various countries. It was felt that it has to be taken up. Reproductive health. Reproductive health is prajanan swasthya. The prajanan swasthya is just not family contraceptive. It has got so many, including infertility. There are many other problems, gynecological and many other problems which affects sort of the morbidity of women and creates problem. So there are many issues around reproductive health. That is why reproductive health was introduced as a comprehensive method to make family planning more effective in the year 1984. and that was reflected in the national population policy. Similarly, it was also thought that if you unless you have the reproductive rights, and what is reproductive rights? Rights of women, men, the couples, whatever family, rights to decide on the family size. Nobody should impose one or two. Decide when to have another child, with what sort of intervals. But it doesn't mean that they will do it just irrationally. Nobody does it irrationally. And for various reasons they have their... So we have to, the policy makers, the service providers have to ensure that the reproductive rights are exercised with appropriate information, appropriate communication, and access to services. Unless these are given reproductive rights, right of reproduction, when to have, how many children to have, all that cannot be exercised effectively. So reproductive health, reproductive rights, I hope, and family planning, I have tried to put them together. But overall, this has to be linked with what is known as social development, equitable social development. If you don't have equitable social development in terms of education, in terms of health, in terms of livelihood and all that, skill building, however you may do, there will be a problem of reducing the growth rate. There will be problem of exercising the reproductive rights. There will be problems of reproductive health, morbidity, etc.
And this will also affect the sex-selective abortions.
This
and
will also
feticide.
sex-selective abortion. One is the traditional of son preference. So there are many measures which can be taken for staving this craving for a son. Already people are feeling, and all that could be one is on the policy level, the supply side, one is the demand side. The demand side, you see, what you need to do is to appropriately empower the women, appropriately empower the girl child by making highly educated, the family structure in a manner the reproductive rights are exercised, and also in a manner in which the girl or woman becomes as much of an asset as they feel a son or a boy is an asset. So this, to make that, you have to look at property rights, you have to look at assets, ownership of assets, equitable ownership, you have to look at employment, you have to look at skill building and all that.
Dr. Mahapatra has a question here.
India is a diverse country, and we know that already in demographically there is a north-south divide, and southern states are doing very well in terms of demographic indicators, and to address all these diverse issues we should have some region specific programs. The country has a full national population policy, but again you need to focus more on certain regions, more to focus on certain regional social groups, because then otherwise this gap will continue. You know that there is some empowered group states in which we are working. I think if you can highlight something on that.
Yeah, absolutely right. National population policy gives only broad guidelines. It has very clearly said that region specific, community specific, diverse groups, like urban slums will have a different thing, like adolescent group will have a different. So all that has been addressed there. Now the problem is that one cannot say that, see, Kerala and Tamil Nadu, they have done like this, and you should try to do similar things in Bihar. It will fail. That's what I think we discussed earlier. It has to be different. Even in Bihar, there are districts, some of them bordering West Bengal in the northern part, will have a different approach altogether. from the approach that you take in the western, southwestern parts. So that is why for any population program to be successful, one needs to have decentralized planning, subject to, of course, all these reproductive rights, reproductive health, and all those guidelines. But those decentralized community-based planning and community-based monitoring, this is a must. And some efforts have already started being taken in that direction, but it is not going that way. It is somehow or other not being pushed that way. So that is what is needed actually. You need to have community needs to be assessed at each village. You have 700,000 villages, 600, whatever, close to 7, or even hamlets. If you take, there will be more than 10 lakhs or 12 lakhs hamlets and villages. So one needs to do that sort of a planning from below. Then only you can have a proper population program which will be more effective. You are very right. I think this is what is needed. Yeah.
I think that holds true for the fact that even individual countries are doing their bit, but
Yeah.
global cooperation is also very necessary in this regard, that how do you address the individual concerns of the countries regarding population.
Well, individual concerns, you see, if you see in 1950s, 1960s, the individual concern of the Western countries, particularly America and others, were a pure psychosis that if India and China large numbers will come up, they will be completely, doing, their importance will go and there will be problem. The Cold War era, so naturally in that context, that is why Paul Ehrlich and others came to the rescue, say population explosion, population bomb, and creating a scare. Then the World Bank, then the Ford Foundation, everybody started giving money only for family planning, only for targeted contraceptive, and that did more harm than good in India. They realized it later. That's why the changes have taken place. But even then, the mindset of some of those people are slow to change.
Dr. Satya has a question here.
We have that thinking that whenever a person dies, the last rites are performed by the male child. So even if the woman is empowered in the family, educated in the family, this patriarchal setup, this thing changes, then only people will not crave for a male child, because they think that only if the last rites are performed by the male child, then only they'll go to heavens.
Education is important, but cannot be the sole. Education, livelihood, those are sort of traditional, let's say, indicators of empowerment. But increasingly we are coming to understand that lot of patriarchy, what you mentioned is, patriarchy is this social sort of order which creates a superiority for men and a kind of discriminatory, is embedded in social norms. And what you mentioned right now was a social norm which has made a condition that the last rites in the Hindu religion can only be done by men. Now, what we have to understand is that education or employment or healthcare, in the absence of social norm change, may have limited application. So increasingly the understanding is that if you want to change gender, and there's this new term that is being used in the gender development world is called gender transformation. So if you want gender transformation to take place where women and men are equal, you will have to understand and address the discriminatory social norms, because clearly there is an unequal relationship between the son and the daughter for their parents. The relationship is son and daughter or parent to child, but there is a distinction in what the parent can, or what the family expects from the girl child and what the family expects from the boy child. Like we often say that beti paraya dhan hai. Now you are the parent of the daughter and you consider her paraya dhan. She has to be first your dhan. I only have a daughter. Mr. Nanda only has daughters. So for us, our daughters are the pratham dhan, not paraya dhan. So I think
I like that.
what we have to move towards, and lot of sort of interventions have now started for early marriage, for declining sex ratio, and certain things which, or let us say, where we have realized that the intervention now is not just economic, and declining sex ratio gives you a very clear example. Spaces or places which are rich, places where women's education is high, have the higher declining sex ratio. So you have states of Maharashtra, Gujarat, Punjab, Haryana, none of them poor states, have the highest decline in sex ratio, the lowest sex ratio at birth. So there is something more which contributes to gender discrimination, and I think all of us, men and women, this is something that I think we have to realize, that women's empowerment cannot be done by women alone. Women's empowerment or gender equality has to be a responsibility, has to be everyone's responsibility, and men have to be equally involved in gender equality, because if men don't give up spaces, men don't contribute to what is traditionally women's work in the home, in childcare, how are women going to get the additional opportunity? India has among the lowest work participation rates for women, and it's falling down across different economic groups. So I think when we talk of gender, we have to talk of social norms, and when we talk of gender, we also have to talk of involving men in all these activities.
But I can add one thing, that what he's saying, the social norms are slow to change, but it is changing. I know of quite a few cases, even in my state, Odisha, I know, where even if they had sons, the son could not come from US, it became late, so the daughter did the final ritual. Even the Brahmins also allowed that. You see, a priest allowed that. And for some of us who do not have sons, we are not going to adopt a son to do that. Or I am not going to ask my brother's son to do that. I have made it very clear. I have asked them that be brave, don't be afraid. When I die, you come and make whatever the last rite is. And we are doing that. We are doing that.
What are the steps that can be taken to cash on this opportunity that we have today? And also, secondly, the day would not be far when this population ages, and soon we may be in a position of what Japan is today. So what measures can be taken so that we don't, how well can we be prepared to face that situation a few years later?
I think that's an excellent question. And oftentimes what you mentioned is called the demographic dividend. Now, why is it a dividend? Because the investment was children of the past who are not unhealthy anymore. Because what happens is, if children are unhealthy, we have high infant mortality rates, and that does not transform into a productive population later on. So what we have now is healthy children becoming a substantial portion of your population in numbers. The question is, are they productive? Because the demographic dividend requires people to be productive. One of the sort of, I think, myths that we have to understand, the moment people are producing more resources than they consume, a population is always an asset. If your population is consuming more resources than it produces, it's a problem. How do you become productive? You become productive by three simple things. Number one, you are healthy. So you have low downtime. Number two, you have capacity. That is, you are either educated, or skilled. And the third thing, there are work opportunities. So your skills and health are contributing to the overall productivity of the country. Now this is where I think we are missing the bus. Our healthcare systems are still not very robust for the poor. Our educational and capacity building systems are still not up to the mark. Yes, we have the skill mission, but our labor force's participation is declining. We are not having enough growth. We are calling it a jobless growth. But if that productivity does not get translated into actual productive capacity, then there is a problem. So that's number one. So those are the sort of policy steps. Some of them have been taken, but I think the results are still to show. The second issue is the question Mr. Nanda had mentioned earlier, is that are we future ready in terms of needs of the older people? Longevity has increased, but our healthcare system is still very mother and child focused. At the most, we are talking adolescents. We do not have even a department of geriatrics in our large hospitals. So, general medicine people are taking care of old age problems. So, we need, at the curative level, we need to have old people's health care as emerging as an area of concern. But healthcare is not in hospitals. Healthcare also has to be at homes and in the community. We have balwadis. Probably we need elder care systems. The other thing we have to realize is the population dynamics, as I had mentioned earlier, is changing. Small families and mobile families. Children are no longer living with their parents. So we have to create social security mechanisms for the older people. We have to have economic security. We do not have a well-developed pension plan across the country. Why do people want their sons to be there? Because that is the economic security. We invest in children, later children will invest in us. Society has to create a mechanism through which the economic security of the older population, even the US, which we try to talk of as a model, has Medicaid, has social security, but we do not have uniform social security, we do not have uniform elderly care in our country. So those are things that we have to talk of to become more future compliant. Look at the changing dynamics of the population. It is no longer MCH, even RCH. Important, RCH is important, but we have to look at the needs of the population pyramid as it grows older.
I would like to thank both the experts, and we deliberated on the issues of population, and we must understand that it is a human resource. It's not a problem, because while we focus on other issues, for example, we are talking about the emissions, we are talking about the other things taking place at the world level, then why don't we think about the population as an issue? It's not a problem, it's a resource, but not only it is like that, we think in terms of economy. We just don't have to think about the numbers getting down, that the statistics and the figures, they are getting down, but it is also about the brotherhood that we have. So it's the social system entirely, everything has to change, and that is how we can achieve the objectives of ICPD. Thank you once again to our guests, to the audience and to the viewers. Thank you.